I'm Jordan Hawk from Vision Wealth Partners, and today I'm very excited to be sitting with Kevin Chaikin from MP Group to have a discussion about Medicare coverage and supplemental policies. Thanks for joining me today, Kevin. So first, why don't you introduce yourself and the work that you do for MP Group?
My name's Kevin Chaikin, and at MP Group, we are a group of independent agents and agency owners serving the Medicare population. So I'm an agency owner inside the MP Group umbrella, and basically what our agency does is we help people from start to finish with all their Medicare needs, starting with education. So we do have a process we've coined. It's called PATH, or your Medicare Path to Success. And the P stands for preparation, which is that education component. We want to give everyone a baseline knowledge of Medicare because it is so new to everybody. It's totally different than their previous health insurance experience. So we go through the education, what their choices are with different plan types and decisions they will need to make and the timelines in which to make them. Once they're ready to move forward, and this could be months or years down the road, we help them with the application process, right? Get enrolled in Medicare A and B, find out your supplemental coverage, help you enroll in that as well. Ultimately, the T in this PATH process is to teach, and that's to teach about the benefits. So what did you sign up for? How do you use this card or this part of your insurance? Where do you go for this? And so those benefits and the costs and just this whole transition to Medicare is new. So we teach them how to use everything. And then ultimately, this is a lifetime relationship. So every time we talk to a client, this is not about signing up and saying, see you later, or maybe we'll only work together for 2 years. We plan to be with you for the rest of your life. So that help is a lifetime service that comes at no cost to the client. We are, at the end of the day, insurance agents. We're paid by whatever insurance company those clients choose. So we're going to be there as an independent resource to help throughout. And ultimately, our goal is just to make sure that that transition is happening properly and they're taking the right steps to continue the appropriate coverage for the rest of their life.
So first, let's start with a common question that comes up as people prepare. Can you describe the difference between Medicare Advantage and Medicare supplements?
Yeah, and this is a great question. It's actually what I refer to with our clients as the big decision on Medicare. Going on Medicare is not necessarily a big decision for most. It's a requirement at some point, right? But Medicare Advantage or Medicare Supplement. So Medicare, basically I'm going to boil it down to keep it simple, is one of these options is more of a fixed cost, predictable option. The other is more of a variable, less predictable option, right? So with Medicare Supplement, you're kind of prepaying for your medical care. There's almost, in some cases, no variability or very minimal variable expense on the back end. You're paying your premium and you kind of know what you're going to spend for the year versus Medicare Advantage where you are going to pay less up front, but you'll pay basically every time you use the service. Now, there's always variability with either program when it comes to prescription costs, so there's never a Medicare Supplement version of a prescription plan. That's always a little bit more complicated. And then the other big difference between these two is really access to care. So Medicare, with the supplement, you're on original Medicare, so the government is the primary payer. And there are no networks, there are no referrals. And so basically, if 90+% of doctors across the country take Medicare, your insurance, including the supplement, regardless of the company it's through, is going to work at all these providers nationwide. With a Medicare Advantage plan, while they are widely accepted, it is more, similar to what you and I have now, whether it's an employer or an individual plan where you've got an HMO network or a PPO network, and your cost sharing is best in the network. The last thing I'll mention here is, drug coverage is included with Medicare Advantage. It is a separate option we help clients with the supplement. Medicare Advantage will also cover certain things that Medicare does not cover, so like dental or basic vision and hearing. On the med sub side, we would help clients obtain separate coverage for those kind of things.
Thank you. Here's another question that seems to be coming up. How is the Inflation Reduction Act affecting Medicare in 2025 and beyond?
Sure. How much time do you have? This can go on for a while. So let's focus on what I guess was kind of already happened and what's coming up for 2025. So, so far on the drug plan, or the drug coverage side of things, we've seen some changes over the last couple of years that are already implemented. So number one is there's a cap on insulin costs. $35 every month is the most someone will pay for a covered insulin. Drug price negotiations began last year. So they came out with the first 10 drugs ever to be negotiated by Medicare. The negotiated rates came out last month. They were pretty substantial. And the next 15 medications, that list is due to CMS by January or February, I believe, of next year. So this drug price negotiation thing is totally new. Medicare's never been allowed to negotiate drug prices. See that as probably a long-term positive considering the amount that Americans pay for prescriptions here, which is quite often quite a bit more than other developed countries, and hopefully saves the program some money over time. The big thing people are talking about for 2025 is the $2,000 max out of pocket. So once again, something that Medicare has never had is a max out of pocket on drug spending. And so next year for anybody who has, if their drugs, caveat this, if their drugs are on the plan formulary, then they will spend no more than $2,000 the entire year on all those medications. And that's a great thing for some people. I will say, the impact is certainly to be determined, right? Because what we also have, read and heard, depending on the data, is, it's maybe 5 to 8% of people were paying more than $2,000 prior to this year. And so while that's great for them, and we never want to see anybody have to make a decision, life or death decision on, getting the treatment and the medications they need, the reality is most people were not spending that much. So then what have we seen as the impact of this going into next year? Well, we're seeing plan consolidation. So there are just less plans, less companies want to really pursue, especially standalone Part D coverage. And number two is an increase in premiums. So we're definitely seeing, some plans have come down or stayed the same on the premium, but generally speaking, we've seen an increase in Medicare Part D premiums, especially for those standalone Part D plans, which, a lot of your clients are going to have with a Medicare supplement. So we're seeing those costs go up. But at the end of the day, obviously, we're hopeful that it does keep, costs down for the Medicare program, save taxpayers money, and then, of course, their individual drug costs out of pocket. Would be great if most people could benefit from that.
Now, what specifically is changing with Part D coverage in 2025?
Yeah, so the big thing does go back to the max out of pocket. Certain things about Medicare Part D have remained consistent. For instance, there are 6 protected drug classes where basically almost all drugs have to be covered. We won't go through the individual classes, but that's remained intact. And then every other plan or every other therapeutic category has to have at least 2 drugs covered, right? So these are things that have remained in place in terms of the actual coverage itself. What we are seeing with the change in the max out of pocket is, perhaps a shift in where those drugs are covered on the plan formulary. So not to get too deep in the weeds here, but you have typically tiers 1 through 5, preferred through brand through preferred generic through specialty, and so maybe there's a shift. Some of those drugs go into a higher tier, which may ultimately cost that beneficiary more money out of their pocket, albeit up to their max out of pocket. Now, one thing that is important to note, 2025 and moving on, is that there are 2 types of drug plans. And so this has been kind of hard to understand for people, and we're explaining a lot of, every day now during annual enrollment, where you have an enhanced plan option and a basic plan option. And basically, the main thing to note about those 2 things, on a basic plan, which is probably going to be your lower cost plan with a $590 deductible, if you spend $2,000 out of pocket, if you reach that cap, that is $2,000 truly out of Jordan's pocket, right? On the enhanced plans, you're probably paying a significantly higher premium, maybe lower to no deductible, and you might actually hit that $2,000 max out of pocket, and you perhaps have only spent $400 or $500. So how's that possible? These enhanced plans have third-party payments from insurance companies and pharmaceutical manufacturers that actually contribute to your max out of pocket. So where you may have gotten by with a lower cost plan previously and could never imagine paying $90, let's say, for a drug plan, you may find that it's worth it because all of a sudden these expensive drugs you're on are being subsidized, in part by a third-party payer, and you're actually only paying a few $100s out of your pocket for the year. So that's a real big difference as it pertains to this legislation going into next year.
So that's a good segue. Let's talk a little bit about the open enrollment period. What do people need to know?
Sure. Yeah, and so, there's all sorts of enrollment periods with Medicare, right? Most people know about, they turn 65, and they've got this 7-month window around their birthday, and maybe they do or maybe they don't need to go on Medicare, right? But everybody at some point goes on Medicare, and that's where we have the annual enrollment period, which is a time every year where you can make changes. So what people really need to know this time of year is your focus is on Medicare Part C or D. So Medicare Part C is Medicare Advantage. This is a time where you can add, drop, or change your Medicare Advantage plan. Or in some cases, we're seeing a lot of companies kind of went too aggressive with their plans previously, and they're pulling out of the market for profitability reasons. And so they kind of are forced to make a change. On the Part D side, that's the prescription side, right? So this is a time where you're going to review and make changes to your drug coverage. And we've probably seen, even though I would say most people don't need to make changes during annual enrollment, it's definitely been a higher percentage even so far in the just a couple weeks that we've been in it so far, because of these things we just talked about the max out of pocket and the different, types of plan options and all those changes. So don't get caught up in reviewing and changing Medicare supplement or dental, vision, and hearing. A lot of people think that, well, I can just address everything now. And annual enrollment actually doesn't impact those things. There is no annual enrollment for Medicare supplement or dental and vision. So those are kind of year-round things depending on your situation. So really focus on Part C and D, what's going on with your drug coverage, what's going on with your provider access, and generally just your benefits overall, especially if you're in one of those Medicare Advantage plans.
What about for people who continue to work and have coverage through their employer, or perhaps have a spouse who's working and are covered under that employer's plan?
Yeah, great question. So as I mentioned the initial enrollment period earlier, right? You turn 65, you're in this window where you're first eligible for most people. And people wonder, well, what do I have to do? I must have to do something. Even if I'm working, do I have to tell the government that I'm not going on Medicare? And you don't. You don't have to do anything necessarily. Now, most people who have a group plan are going to be able to continue on that group plan without going on to Medicare. And sometimes, like you mentioned, a spouse, you might really need to stay on there. Even if you're ready to retire, your spouse is a few years younger, you're just going to keep working to make sure he or she is covered and of Medicare age. So basically, the way Medicare looks at it is on employer size. So if you're at 20 or more employees, then Medicare says, okay, the employer coverage is primary. And in that case, you can go ahead and keep your coverage. It will pay first. Typically, no need to get Medicare, although a lot of people will get Part A, which is premium-free hospital coverage. It will be secondary to their employer coverage, so it's nice to have a little something extra. But of course, there's always a nuance or exception to the rule, and that would not be the case. You would not want to get Part A if you are making health savings account contributions, right? So there's always a little something to make sure you're asking about, but a lot of people can delay Medicare. If you are, self-employed, you're on a small group plan with, less than 20 people, you're on an individual, ACA plan, those folks, you have to go on Medicare. Otherwise, you may face late enrollment penalties later and be subject to perhaps you being the primary payer, which obviously that can be a dangerous thing if you're covering 80%, right? So biggest thing is check on employer size. And, certainly could talk to HR, your benefits administrator, just to be sure it's what Medicare considers creditable coverage.
Yeah, that's really helpful. Thank you. Finally, what are the advantages of working with a broker through the enrollment process?
Sure, yeah. I mean, look, at the end of the day, health insurance is not something that, we spend a lot of time thinking about, right? Honestly, I bought health insurance as an individual one time in my life. Every other plan I've had has been through an employer. And I didn't really have a choice. It's just take this or that option. That's it. It's this company. That's not the case. So we're not really trained, right, on how to do this. So it's a very confusing program, right? We already talked about there's one big decision about Medicare supplement versus Advantage. And then you make that decision, and it's like, well, what supplement, what company, what drug plan, what dental, what extra benefits, where can I go? So there's a lot of things that we're just not ever trained on. The government doesn't tell you when to enroll in Medicare. They don't tell you really how to go or where to go or how to to go about picking your plan. So what we're ultimately going to do is help you understand, look, this is totally new. We understand it. We're starting at square one. That's why I mentioned education earlier. We really pride ourselves on the idea of educating people first and then helping you select the plans and ultimately providing you the insurance solution. So getting educated, making sure you're not missing any timelines. I don't know if I ever told you this story, but my dad, but I got into this business kind of right around the time he was dealing with Medicare, and it was so eye-opening that people need help because he made certain mistakes that resulted in a late enrollment penalty, him having to buy an individual policy at 65 plus, which is very expensive, on the open market. And it's just, there's nothing intuitive about it. You're just like, I don't know. Hopefully I did this right. All right. So making sure we don't miss enrollment timelines, avoid penalties, avoid lapses in coverage, making sure that, hey, there are certain coverage decisions that might impact you the rest of your life. You may not be able to make certain changes either. So, don't pick something because it works for what you have, your situation now, your medical conditions now, and you may not be able to get something else later, right? So there's a lot that goes into it. And look, at the end of the day, we're an independent resource, as many of our colleagues around the industry are, so we're not beholden to an insurance company. It's like we just want to make sure that we're finding the right solution for you. It's not about, making a square peg fit in a round hole. We have to make sure that your solution is your solution for you. And guess what? Your wife might have a totally different insurance, right? Because she's got her own insurance and her own needs. So just someone that's going to focus on finding, what's right for you. And again, there's no cost, and it's a lifetime or a lifelong relationship.
Yeah, that's really helpful. Thank you. And thanks again for joining me today. I think our clients and others can benefit tremendously from this conversation.
I appreciate you having me here.
Of course. For more videos on a variety of wealth management topics, head to our YouTube channel. Thanks for watching. I'm Jordan Hawk from Vision Wealth, your dedicated wealth management partners.